Hi everyone, I'm Jenny Rogers, and today we're going to be talking about how to prepare for delivery. So this is for all of my parents that are 35 weeks, because during our pregnancy, we typically try to strengthen core, strengthen pelvic floor, strengthen glutes to be able to be good and supported throughout our whole pregnancy as our anatomy is changing throughout. But once we get to 35 weeks, we want to start shifting gears a little bit to be able to start preparing for actual delivery. So during the pregnancy, we've been trying to be strong and sturdy with that pelvic floor to hold everything in. But now we want to start preparing for those pelvic floor muscles to be able to relax, open, lengthen, to be able to prepare for baby to exit. A lot of people think that you want strong pelvic floor muscles for it to deliver baby, but in reality, you want pelvic floor muscles that are able to relax and to get out of the way to allow the uterus to contract. And that is what actually helps with propelling baby and pushing baby out. So there's a couple of things I have people do. I have them do a couple stretches to help open the pelvic girdle. So the first one I like is doing a deep squat. Sometimes this is hard when we have baby here. So you can do more of a supported squat. You can go against a wall and squat down here and be sitting on a couple of pillows. If this position is too low and difficult to get to, you can always have a stool or, extra pillows, like maybe the body pillow you've been sleeping with, and work on this position with sitting. If you have a birth ball, you can also have it in front of you and start working on leaning in front, getting those inner thigh muscles just a little bit of a stretch, because those inner thigh muscles attach to your pubic bone. So if your inner thigh muscles are tight, most likely your pelvic floor muscles are tight as well. So you can work on rolling out in front and coming side to side. Research shows holding a stretch for 30 seconds creates lasting change. So that's what we shoot for. With any stretch you're doing, just hang there for about 30 seconds. Okay, so we have this one, or the deep squat against the wall if you need a little bit of support. If you can tolerate leaning side to side, that's also great to get a little bit of movement within there. All right, the next one is a wide leg child's pose. So we're shooting for opening up our legs and then coming down forward and hanging head low and doing some deep breathing in this position. All right. The deep belly breathing, we practice on inhaling. Our belly should rise and our pelvic floor should actually move down, sink, relax, open, and lengthen. That's helping those muscles to open up. Imagine like it's a flower moving open. When we exhale, our pelvic floor muscles do a little bit of a contraction and actually move upwards. So I like to hold with our legs here, but I also like us doing a pose with our legs internally. So on the back, I've actually put two little stickers on my ischial tuberosity to show you the relationship of the pelvic girdle opening. So when our legs are here, this is helping to open the front pelvic girdle, but actually closes down the back of it. When I bring my knees in, that actually helps to open the back of our pelvic girdle. I'll do that again. So here, squeezes it closer. Here, brings it wider. So I also have people practice bringing legs in and sitting back into it some to help open the back of our pelvis, the back of our pelvic outlet, holding for at least 30 seconds and then coming back up. All right. If down here in child's pose is difficult, you can do a supported child's pose. So finding a stool to lean on, lean forward. You can also use another ball here if you want to do that. Again, holding for 30 seconds. If getting down to the floor is not ideal, you can always do more of just a standing position. So coming up, spreading legs apart and leaning side to side. Adding a little bit of a hip hinge in there and shifting back and forth, stretching inner thighs and the pelvic floor muscles. All right. The next thing I have people do is a thing called perineal massage. So perineal is the skin between the vaginal opening and the rectum. You can look it up online if you want to see a picture of exactly where it's located, but I'm going to use my hand for an example of the vaginal opening. All right, so if this is my vaginal opening, up towards your pubic bone is 12 o'clock, down towards your rectum is 6 o'clock. This area, that skin between vaginal opening and the rectum, is called the perineum. This is a spot that holds a lot of tension, a lot of sneaky tension where those muscles are just very stiff. The research is mixed if this can truly help prevent tearing by doing perineal massage, but the idea is to make those tissues in the skin and all the connective tissue more flexible, making it so it has a better chance to open and relax, less chance of tearing. So I have people start this at 35 weeks. We have our, I'm going to do it this way. We have our vaginal opening, and you can either use your finger, you can use your thumb, more of a hook. You can also use partner's finger if they're willing, or you can talk to your pelvic floor therapist about potentially using a dilator. But you're just working right at the opening, not very deep at all. So you have your finger here or your thumb, and you can also do this reclined in bed with both of the openings. You can do it in the bathtub. You can do it reclined in an actual recliner, either you or by your partner. But we're here. We're going to hook on, not very deep in at all. And then you're going to glide back and forth. You can also use lube, which is really helpful for those tissues to prevent irritation. But you're going back and forth. You can also do a little bit of a pulling motion or a stretching. So hooking, giving a little bit of a tug, holding for about 10 seconds while doing that deep breathing to help those muscles to relax. And then you move to another spot, holding for about 10 seconds and work your way around the whole bottom. Okay, just getting those tissues good and flexible. You can work on it for 5 to 10 minutes. I wouldn't do anything more than that. Your muscles could be sore for about 24 hours, but that's okay. If you're sore for longer than 24 hours, that just means to do less pressure next time. But doing that consistently prior to birth can help prepare you for that. The last thing I'm going to talk about is what breathing you should try during delivery. So a lot of times people are told to bear down, hold your breath, and push, otherwise known as the Valsalva. What happens with the Valsalva maneuver, it actually clenches all those pelvic floor muscles, making it really hard for baby to actually get through. So instead, I want you to practice doing what we call the ring of fire. So you do a big inhale. Those pelvic floor muscles are open, lengthen, and relaxing to allow space for baby to exit. And then on your exhale, I want you to imagine that you're pushing from your throat all the way down towards baby, like you are trying to send a breath down towards him or her. So doing a breath in and then a breath out, as if you're pushing down and out through your pelvic floor to assist that uterus in pushing out. So those are just some things that you can practice prior to. And during delivery, you're really focusing on trying to keep jaw nice and relaxed, trying to keep shoulders nice and relaxed, trying to keep pelvic floor nice and relaxed as much as you can, right? We all have our plans, but things happen during actual delivery. But hopefully that this is some helpful tips for you to prepare and go into delivery more confidently. Thank you.